The Elder Care Protection Bill has officially passed, and this represents one of the most profound and significant legislative shifts for older Americans in several generations. This is not merely a collection of minor adjustments or a simple update to existing laws. It is a fundamental restructuring of the safety net that supports health, finances, and dignity for everyone over the age of 60. At the Golden Seniors Hub, we believe that factual, authentic information is the only way to navigate these massive changes effectively. This bill directly addresses the rising costs of living, the instability of healthcare pricing, the safety of care facilities, and the long-term security of the systems you have paid into your entire working life. However, it is essential to realize that while the law has successfully moved through the United States Senate, the implementation of its many benefits often relies on the individual. Some of these changes are automatic, but many require you to interact with federal agencies, update your files, or apply for specific programs within strict timeframes. This is about more than just numbers on a page. It is about ensuring that the promise of a secure and dignified retirement remains intact for every single citizen. The background of this bill is rooted in years of tireless advocacy. For too long, the specific needs of the aging population were treated as secondary issues in the halls of power. Seniors across the country were facing a healthcare market where prices were dictated by manufacturers without negotiation, a housing market that was not built for physical accessibility, and a digital world where scammers operated with almost no federal resistance. The Elder Care Protection Bill is a direct response to these systemic failures. It touches on healthcare, housing, financial security, and mental well-being, creating a comprehensive framework that aims to provide stability in an increasingly expensive and complex world. This is a massive win for transparency, but the sheer complexity of the bill means you need to know exactly where to look for the help you deserve and how to claim the benefits that are now rightfully yours. One of the cornerstones of this legislation is the aggressive and long overdue reform of prescription drug pricing. For the first time in American history, the federal government is being empowered to negotiate the prices of the most expensive and widely used medications. This is a massive shift in economic policy that finally favors the consumer over the corporation. If you are currently managing a chronic condition like diabetes, arthritis, or heart disease, you know that the monthly cost of insulin or blood thinners can be staggering and often forces families to make impossible financial choices. Under this bill, Medicare will use its collective bargaining power, representing over 65 million people, to bring those prices down to levels seen in other developed nations. Furthermore, the bill introduces a mandatory cap on out-of-pocket drug expenses. This means there is now a hard ceiling on what you will ever pay in a single year for your prescriptions. Once you reach this annual limit, your covered medications for the rest of the year will be fully paid for. This creates a vital financial safeguard that prevents a single illness or a new diagnosis from draining a lifetime of hard-earned savings. Regarding Social Security, the Golden Seniors Hub wants to highlight how this bill addresses the long-standing complaint that the annual cost of living adjustment, or COLA, does not keep up with the actual inflation seniors experience. Historically, the government used an inflation index based on the spending habits of younger urban workers, people who spend more on gasoline and electronics and significantly less on healthcare. The new bill advocates for the adoption of a specialized index that specifically tracks the rising costs of medical services, home care, and specialized nutrition. This means that future adjustments to your monthly check will be more closely aligned with your actual grocery and pharmacy receipts, rather than a generic national average. Additionally, the bill strengthens the solvency of the Social Security Trust Fund by adjusting the payroll tax cap. By ensuring that the highest earners in the country contribute a more equitable share into the system, the law provides a stable pathway to keep the program fully funded for decades to come, ensuring that today's retirees and future generations can rely on their checks without the fear of sudden cuts. Nursing home reform is another critical pillar of this new law that deserves significant attention. The quality of care in long-term facilities has been a major concern for millions of families, often exacerbated by low staffing levels and a lack of transparency. The Elder Care Protection Bill mandates specific, much stricter minimum staffing ratios for any facility receiving federal Medicare or Medicaid funding. This is a massive victory for resident safety and human dignity. It ensures that there are enough nurses and trained aides on the floor to provide timely assistance, manage complex medications correctly, and offer the personal attention that every human being deserves. To ensure these rules are followed, the bill significantly increases the financial penalties for non-compliance. These fines are now high enough to impact a facility's bottom line, making it more profitable to provide high-quality care than to cut corners on safety. Furthermore, the bill requires the public disclosure of inspection reports, staffing data, and violation histories in a format that is easy for families to read and understand, allowing you to see past the brochures and understand the reality of a care facility. Financial protection is also a top priority within this legislation. The bill recognizes that elder financial abuse is a silent epidemic in America, costing older adults tens of billions of dollars every year. Criminals have become increasingly sophisticated, using advanced technology to trick seniors out of their life savings. The Elder Care Protection Bill provides substantial new resources for federal law enforcement to track and prosecute these international scam rings. It also creates a mandate for financial institutions to implement specific protective protocols. This allows banks to temporarily pause suspicious transactions, such as a sudden, large wire transfer to an unfamiliar account, while they verify the request with the account holder or a trusted emergency contact. By building these digital guardrails, the bill aims to stop fraud at the source before the money ever leaves the account. Public education campaigns are also being funded at a record level to ensure that every senior knows how to identify the red flags of a scam before they ever pick up the phone or click a suspicious link. Housing stability is addressed through significant expansions in programs designed to help people age in place. Most individuals want to remain in the comfort and familiarity of their own homes, but physical barriers often make this dangerous or impossible as mobility changes. The bill provides a new wave of grants and low-interest loans specifically for home modifications. These funds are designated for essential safety upgrades, such as installing wheelchair ramps, widening doorways, and retrofitting bathrooms with grab bars and walk-in showers. By making these modifications affordable, the bill helps seniors maintain their independence and avoid being forced into an institutional setting before they are ready. The bill also promotes the development of multi-generational housing projects that integrate social services and healthcare access directly into residential communities, fighting the physical and emotional toll of social isolation, which researchers have found to be as damaging to health as smoking. Mental health coverage under Medicare is seeing its most significant expansion in years. The bill acknowledges that emotional well-being is just as vital as physical health. It increases the reimbursement rates for psychologists, clinical social workers, and psychiatrists who treat Medicare patients. This is designed to encourage more providers to accept Medicare insurance, making it easier for you to find a qualified therapist in your local area. Additionally, the bill permanently expands the use of telehealth for mental health services. This is an absolute game changer for those who live in rural areas or have difficulty with transportation. Being able to speak with a professional from your living room removes a major barrier to care and ensures that no one has to suffer in silence. The law also funds outreach programs to reduce the stigma associated with seeking mental health support, emphasizing that managing grief, anxiety, or depression is a normal and necessary part of healthcare. The bill also finally provides meaningful, tangible support for family caregivers. There are millions of Americans who provide unpaid care for their parents or spouses, often at a great personal, physical, and financial cost. The Elder Care Protection Bill introduces new federal tax credits for eligible family caregivers to help offset the costs of medical supplies, transportation, and home care services. It also creates a national resource center to provide training and support for those managing complex medical needs at home, ensuring that caregivers have the skills they need to feel confident in their roles. Perhaps most importantly, it expands access to respite care, which allows a primary caregiver to take a much-needed break while a professional steps in temporarily to provide care. This support system is designed to prevent caregiver burnout, which in turn leads to better outcomes and a higher quality of life for the seniors receiving the care. As we look toward the future, the Golden Seniors Hub wants to emphasize that the benefits of the Elder Care Protection Bill are yours to claim, but you must stay informed and vigilant. The rollout of these many programs will happen in stages, and you need to be wary of any third-party services that charge a fee to help you sign up for these new benefits. Official government assistance is always free. You should reach out to your local area agency on aging or your state's health insurance assistance program for unbiased guidance. The passage of this bill is a major milestone, but it is only the beginning of a new era. It represents a commitment to the idea that growing older in America should be marked by security, respect, and support, not by fear and financial struggle. Furthermore, this legislation places a heavy emphasis on the integration of modern technology and healthcare. It includes provisions for the expansion of remote patient monitoring tools, which allow your doctors to track vital signs like blood pressure and glucose levels from a distance. This reduces the need for frequent, exhausting office visits and allows for early intervention if a health issue arises. These technological advancements are being paired with strict privacy protections to ensure that your sensitive medical data remains secure. The bill also funds the development of community-based health centers that act as one-stop shops for seniors, offering everything from primary care and dental exams to nutritional counseling and fitness programs. These centers are intended to serve as the hub of a new, more holistic approach to aging that treats the whole person, not just a list of symptoms. The Elder Care Protection Bill also addresses the often overlooked area of legal assistance. Many seniors struggle to navigate complex legal issues related to estate planning, tenant rights, or the appeal of insurance denials. The bill increases funding for legal aid programs that specialize in elder law, providing free or low-cost representation to those who need it most. This ensures that you have a professional advocate in your corner when dealing with large bureaucracies or legal challenges. It is about balancing the scales of justice and ensuring that your voice is heard in every legal proceeding that affects your life. In closing, the passage of the Elder Care Protection Bill is a testament to the power of collective action and informed citizenship. It is the result of millions of voices demanding a better, fairer system for our nation's seniors. While there will undoubtedly be challenges in the implementation phase as these new rules go into effect, the framework is now firmly in place to create a safer, more affordable, and more supportive environment for everyone over 60. The Golden Seniors Hub will continue to provide regular updates as new sections of the law take effect and as enrollment windows open. Remember to keep your records organized, stay in constant communication with your healthcare providers, and never hesitate to ask questions. You have worked hard to reach this stage of life, and this legislation is designed to ensure that you can enjoy it with the peace of mind and security you deserve. Knowledge of these changes is your greatest asset. Stay informed, stay protected, and know that your contributions to society are being recognized and defended through these new legal protections. The journey toward a better, more compassionate elder care system has taken a massive leap forward today. To add even more depth to your understanding, it is important to realize that the Elder Care Protection Bill also focuses on nutritional security. Many seniors face food insecurity, which means they do not always have access to the healthy food they need to maintain their health. The bill expands the eligibility for nutritional assistance programs and increases the funding for Meals on Wheels and similar community programs that deliver hot, healthy meals to those who are homebound. This ensures that no senior has to choose between paying for their medicine and buying healthy groceries. Proper nutrition is the foundation of health, and this bill treats it as such. Additionally, the bill addresses the issue of transportation, which is often a major barrier to independence. It provides funding for local communities to expand senior-specific transportation services, making it easier for you to get to doctor appointments, grocery stores, and social events. Whether it is through specialized van services or subsidized ride-sharing programs, the goal is to keep you mobile and connected to your community. This reduces the isolation that can lead to depression and physical decline. The Golden Seniors Hub also wants to point out that the bill includes a Senior Bill of Rights within care facilities. This section of the law codifies the rights of residents to be treated with dignity, to have privacy, to participate in their own care planning, and to be free from unnecessary physical or chemical restraints. It creates an ombudsman program in every state, a dedicated advocate whose only job is to investigate complaints from nursing home residents and their families. This provides a clear, official channel for addressing concerns and ensures that no resident is left without a voice. Finally, the bill looks at the importance of lifelong learning and engagement. It provides grants to community colleges and local libraries to create programs specifically for seniors, ranging from technology training to arts and humanities. Keeping your mind active and learning new skills is one of the best ways to maintain cognitive health. This bill recognizes that the golden years should be a time of growth and exploration, not just a time of slowing down. By investing in these programs, the government is investing in the intellectual and social wealth of our senior population. As we move forward, remember that your engagement is what makes these laws work. When you use these programs, when you report fraud, and when you advocate for your rights, you are strengthening the system for everyone. The Elder Care Protection Bill is a massive document with many layers, but at its heart, it is a promise of respect. At the Golden Seniors Hub, we are honored to be your source for the facts as this new era of senior protection begins. Stay tuned for more detailed breakdowns of each section of the bill in the coming weeks. Your future is more secure today than it was yesterday, and by staying informed, you can make the absolute most of every protection this new law provides.